Now, for more on the challenges of mental health and the financial implications, let's bring in Dr. Alfiee Breland-Noble. She's a psychologist, author, and founder of youth mental health nonprofit, the Akuffo Project. She also hosts the Couched in Color podcast. Welcome back to the show.
Thank you so much for having me.
So I want to first start with your reaction to Osaka's withdrawal from the French Open and now, of course, the Berlin event. How would you grade the way her sponsors have responded, as well as the tournaments themselves?
I think her sponsors have been wonderful. They had a little bit of time to regroup and think about how they wanted to support her and be responsive to what she shared. I think the tournament in general and the WTA in general did not handle this as well as they should have. And I think what it resulted in is really shining a spotlight on how employers really must do better in terms of how they help and support people with mental health concerns. I will say that she was extremely brave as a woman of color in sharing in such a prominent role in sharing what she was dealing with so publicly. But I do think it was handled quite poorly from the start by the tennis sponsors and some of those folks in administration.
Because we certainly do see different treatment when it comes to a physically visible ailment or illness, but it's sad that we don't see that same sort of compassion. So then, since then, has the Women's Tennis Association become more serious about this conversation? And what should a player then do? What should they be doing then when a player does voice these concerns?
Yeah, so a couple of things. I think it's a wonderful question, Rachelle, and I really appreciate you asking it. I personally have not seen what the WTA has done differently. I will say that initially, one of their statements was that they have a mental health team, but I was hard-pressed to find who comprised the team and that sort of thing when I went looking myself. I think there's another layer to this with Naomi Osaka being a woman of color, and that speaks to these issues of cultural competence. And so I think some of the key issues that employers really need to address, and in this case, the WTA and some of the tournament sponsors need to address, are not only mental health issues, but ensuring that the mental health supports they provide are really culturally relevant and rooted in some of the needs of people of diverse backgrounds, because you're talking about a global entity in terms of who plays tennis. And so we want to make sure that everyone has a greatest opportunity to get the kind of help that's really going to benefit them in their mental health.
And clearly we've seen, even from the new OECD report, saying that governments around the world are not doing well in responding to mental health matters, and that's become an even bigger issue during COVID. What issues are people dealing with right now, and how are we seeing that play out at work and at home, for example?
Absolutely. So the biggest issues that we're seeing, I don't think anyone would be surprised by. So looking at some data that I heard recently and saw from the Kaiser Family Foundation, what we find in the United States specifically is that about 3 years ago, 2019, around 11% of adults reported meeting criteria or having symptoms of anxiety and or depression. That number tripled going into 2020, the earlier part of the pandemic, and has stayed consistent since then. So we're looking at about 40% of adults reporting that they meet criteria for anxiety and or depressive disorders. I think as it relates to employers, some of the struggle has been, how do you provide care, as we saw in the segment, when people are working remotely? How do we provide care for sheer large numbers of people when we know that there are probably not enough mental health professionals available globally to meet the demand? And then how do we ensure that we incorporate things like preventative measures and reduce stigma so that people will either not have to go into care, or when they go into care, will feel comfortable seeking it within the workplace? So that stigma and how it impacts our careers, I think those are real issues that employers are having to grapple with. And it's going to be an ongoing thing as we move out of the pandemic and see some of these mental health issues continue to stay with us.
So then what sort of domino effect can this have on the economies at large?
Oh, absolutely. So I participated in an event a couple of weeks ago where we talked about that specific question. And I think some of what it does, when you think about, we have something called disability adjusted life years. And so that's the number of years lost related to a disability, of which we can look at depression and some other mental health concerns meeting that criteria. And so what happens is people are unable to function within the workforce because they don't have the care that they need to keep them going, right? So mental illnesses are treatable, but if you don't have access to care, you cannot get the treatment that you need to allow you to continue to function. And of course, that takes you out of the labor force. There are other things like having to caretake for people who may be in your family who are struggling with mental illnesses, who may have severe and persistent mental illness. And so again, if there's no care available, this individual is now pulled out of the workforce and unable to provide for their families. It impacts our income because if you don't work, you don't eat, you don't generate income to bring into the home. And that impacts the economy because you now don't have money to spend within the economy. So it definitely, to your point, has a domino effect. And it's something that we really have to be serious about treating at the front end, these issues of mental health and mental illness.
So then after the year and a half that we've had living with this pandemic, why is the idea of so-called getting back to normal or the way things were being met with a lot of pushback by a large share of employees who worked from home during this period?
I think what I've seen and what I've read and when I've talked to people is that many people have found that their mental health in some ways has improved in relation to being able to be home, being able to be comfortable in their own surroundings, to work at their own pace, to get away from some of the enormous pressures that some of us feel in the workplaces that we work in, not to mention for others. They're working in toxic workspaces where they're dealing with issues of racism, sexism, homophobia, and those different isms. And so being at home for many, not for all, but is a safe environment and it's allowing them to function in a little bit better ways than they were in the workplace. So I think that is some of the issue. And then there are issues like the commute. So there's all the collateral damage that impacts our mental health related to commuting to work and being in the workplace on a day-to-day basis. And I think people are recognizing that being at home, being able to work at their own pace, for many, not for all, has been beneficial for their mental health.
Well, hopefully they get the help they need. We know the mental health professionals are doing the best they can. We do appreciate you. Dr. Alfiee Breland-Noble there, psychologist, author, and founder of the Akuffo Project.